Dear audience, let me share my progress on my PhD topic, metabolic changes in pancreatic disorders. I'm Mónika Lipp, a PhD student and a gastroenterology resident at Semmelweis University. I'm working with the supervision of Alexandra, Mikó, and Péter, Hegyi. My personal vision is the early detection and evaluation of metabolic changes in pancreatic disorders. My mission is to improve the clinical assessment of patients with pancreatic disorders. Here you can see my ongoing project. We are investigating the effect of fatty pancreas as a risk factor for pancreatic cancer by conducting a meta-analysis. As a second plan, we try to understand the connection between metabolic changes and the disease progression through a register analysis. First, let me introduce my first project on investigating the effect of fatty pancreas as a risk factor for pancreatic cancer. Let me tell you a few words about the background. It is known that pancreatic cancer takes the first place among asymptomatic cancer. Moreover, it is among the leading causes of cancer mortality in developed countries. Only 4% of the patients will live 5 years after the diagnosis. It is recognized that pre-existing metabolic disorders can contribute to the development of pancreatic cancer. Study shows that there is a link between fatty pancreas and pancreatic carcinoma. Fatty pancreas, described as a fat infiltration of the pancreas, mostly due to obesity, presented in 30 to 35% of the patients. Our aim is to detect the association between fatty pancreas and pancreatic cancer. We wanted to investigate if fatty pancreas predisposed to the development of pancreatic cancer or not. Case control and cross-sectional studies were included where the presence of fatty pancreas was described. Our main outcome of interest was the prevalence or the ratio of fatty pancreas, with the hypothesis that fatty pancreas increases the risk of pancreatic cancer. The clinical implication would be the early detection of the pancreatic cancer. Here you can see our systematic search. We conducted it in the 3 main databases with the final search key you can see below. Here you can see our flowchart of the selection. Currently, we are at the full text selection phase. Now I would like to focus on our second project, where we try to understand the role of metabolic changes in disease progression on goulash trial patients following acute pancreatitis. Metabolic syndrome has a key role in the development of acute pancreatitis. It has been shown that diabetes and hyperlipidemia makes the most severe AP, but we do not have any information about what happens after an acute pancreatitic episode. What are the most frightening consequences of this disease? How recurrent acute pancreatitis, chronic pancreatitis, or pancreatic cancer will result in this process. Goulash Plus is an observational longitudinal multicenter investigation of acute pancreatitic patients, and they are followed up until 6th year every year. Our aim is to understand the influencing factors and to determine which parameters should be measured to detect the early phase of chronic pancreatitis. I would like to highlight that on admission and peak in-hospital glucose levels are independently and dose-dependently associated with increasing acute pancreatitis severity and mortality. Hypertriglyceridemia dose-dependently aggravates the severity and related complications acute pancreatitis. Obesity, hypertension, and hyperlipidemia are independent risk factors for a number of complications. BMI above 25 increases the risk of severe AP, while BMI above 30 increases the risk of mortality. Our aim is to understand the different parts of the metabolic syndrome in this process. We wanted to know what are the main factors that contribute to the development of different pancreatic diseases. We included patients from the GULASH trial, and the main outcome of interest would be the ratio of newly developed pancreatic diseases as recurrent acute pancreatitis, chronic pancreatitis, or pancreatic cancer. Our aim is to understand the different parts of metabolic syndrome and their role in this process. The clinical implication would be the prevention or the early detection of these contributing factors. Well done is better than well said by Benjamin Franklin. Thank you for your attention.